TPLO in dogs. The TPLO, Tibia Plateau Leveling Osteotomy, in dogs consists of a surgical modification of the orientation of the tibial articular surface. Ruptured cruciate ligaments in dogs. The knee joint is a complex joint. In addition to the bones, it has several ligaments, tendons and other fibrous cartilages, such as the menisci, which are essential for optimal functioning. Unlike humans, whose cruciate ligaments are usually torn as a result of a sports accident, in dogs it is often a degenerative disease that progresses gradually. It ends with the rupture, tear, of the cruciate ligaments, mainly the anterior ligament. This leads to more or less significant lameness and instability of the limb, the cruciate ligaments normally preventing, among other things, that the femur slips on the tibial articular surface inclined backwards. TPLO in dogs. What is it? The TPLO operation of the cruciate ligaments in dogs is another technique aimed at stabilizing the cruciate ligaments. This involves rotating the angle of the tibial plateau, tibial articular surface, usually about 25 degrees, different from one dog to another, up to an angle of about 5 degrees. To determine the exact values, special X-rays are made before the operation, on which the angle of the tabletop can be measured. The operation is performed under anesthesia general. The surgeon saws off the tibial plateau and changes its orientation so that the articular surface is almost horizontal, 5 degrees. The tibia is then refixed in the new position using screws and a special plate. This leads to a change in the distribution of forces in the joint, now also able to function stably without cruciate ligaments, the femur no longer in danger of slipping. The new generation implants often remain permanently in place. As with all operations under general anesthesia, the dog must be fasting for the operation of the cruciate ligaments. Your veterinarian will inform you of any other precautions to be taken in view of this operation, for example if your dog must receive certain medications. After the operation, the animal remains under veterinary supervision until it has regained full consciousness. In addition, it often happens that the instability of the knee has led to crushing and tearing of the menisci. This injury can risk causing severe pain later. Before the TPLO operation in dogs, the injured parts of the meniscus are removed from the knee joint. Possibilities and limits of the TPLO. Unfortunately, it is not possible to eliminate osteoarthritis that is already present. However, the severe pain present before the operation is significantly reduced or disappears completely and the progression of osteoarthritis is slowed down. Healing process following a TPLO and post-operative follow-up. When the TPLO healing process is at its best, the bone is healed within 8 to 12 weeks. After the operation, the dogs are given painkillers and preparations aimed at restoring cartilage. Physiotherapy also promotes the healing process. Under no circumstances should your dog gain weight as this will significantly increase the load on the limb. As for the post-operative follow-up of the TPLO, the dog must also be kept on a leash for 6 to 8 weeks in order to avoid sudden strong stresses on the knee. The bone needs time to heal. In principle, the paw can already be solicited with precaution just after the operation. Your vet will give you an exercise plan as light movements each day, gradually increased, will help get your dog moving again. The strain on the operated knee joint thus increases gradually. If the dog no longer limps and feels no more pain once the bone has completely healed, nothing prevents him from resuming normal activity or sport. Benefits of the TPLO for the dog. TPLO treatment has many advantages. Thanks to the fixation by implant, the bone can be slightly stressed again just after the intervention. Dogs with a partially torn ligament can also be operated on with this technique. Consequential damage and pain can thus be avoided. The TPLO technique can, in principle, be used for all dogs, regardless of their size. Possible complications after TPLO in dogs. After a TPLO, the bone may be slow to heal or the implant may loosen. Wound infections, inflammation of the patellar tendon or meniscal lesions may also occur and require further surgery. These complications affect up to 14% of operated dogs. Costs of a TPLO in dogs. The costs of the TPLO are made up of different elements. The veterinary service as such, but also the medicines, the dressings and the suture material and, of course, the post-operative care. If you have any questions about the costs of TPLO for cruciate ligament rupture in dogs, ask your veterinarian who will gladly advise you. Other cruciate ligament operations in dogs. TPLO is not the only possible treatment for cruciate ligament rupture. Other cruciate ligament operations in dogs are the tibial tuberosity advancement, TTA in dogs, technique and several ligament replacement operations. These aim to replace the torn ligament or modify the joint capsule of the knee joint, so that it stabilizes it.